Thank you for coming to this video. Today I'm going to be addressing one popular questions that has come to me over the years of creating health topics or health videos. Now, firstly, this video is just going to address a question. If you have further questions about this topic, you can drop it in the comment section and I will go through and address them individually. So people usually ask me, what causes increased palpitation or anxiety, or what are the triggers?
Madam, I beg, you get the drug where they cure heartbreak. I carry Chelsea straight win. Flamengo beat them 3-1. My body they shake.
Okay, so generally, anything that has to do with anxiety, stress, palpitation, they are linked together. Okay, and now the triggers can be emotional or psychological. All right, and many times when it comes to palpitation and anxiety attacks, many persons do not really know what triggers it, because sometimes you can be peaceful, be happy, you can be in a party, enjoying yourself and living your life, and then the moment you sit down to just maybe reflect on something, or maybe the moment you sit down to just do nothing exactly, you start having this increased heart rate. Now some of those things can be emotional. It can just be a backlog of things that have stressed you over time, and then they're coming up to play.
Sorry, ma.
All right, now one way to address anxiety and palpitation is to do the breathing exercise. All right, now when you have anybody who is having a panic attack, anywhere, anxiety attack, you just ensure the person is seated, and then if there's any clothing that obstruct, maybe the person is putting a tie, the person is wearing hijab or scarf, you can want to remove all of that, especially if you take permission from the person and say, oh, this is a life or death issue. You want me to remove your stuff, whatever you wear, because people can be very, very troublesome these days.
I don't want peace. I want problems always.
Right. So when you take that necessary permission, you remove all those things, and then you let the person breathe. You let the person count. Usually, you don't tell the person to count from 1 to 100. You tell the person to count that backwards from 100 to 1. So usually, before the person gets to 1, the anxiety or panic attack will be over. Because usually, what breathing exercise does is it helps the attention of that person to be in the counting, especially if it's not some easy counting. You're telling somebody to count from 100 backwards, for example. The person is going to be thinking about the numbers, you understand? So whatever is making them panic will definitely leave their mind, for some anyway. All right. Now, sometimes palpitation and anxiety or panic attack can actually come from abuse of substances.
Jesus!
Like alcohol, like caffeine, like people who smoke. So if you have persons who have any of these habits, you want to address it and tell them to stop. Or if you are watching this video right now, you want to stop, you want to drop some of them, you want to reduce your alcohol intake, you want to reduce your caffeine intake, and then you want to reduce your smoking habits, because usually what it does is that it actually affects your heart rate and causes increased palpitation. So what I'll advise you is drop all of those things and then look for how to get involved in mild exercising, so that your body can get used to addressing, or your body can get used to recovering fully from all of those attacks that you get. Now, I have to say this. There's some persons that are in abusive relationship. Now, I know most of my students, when they come to class, part of the topic I teach them along every pharmacology topic I tell them is how to be in a good relationship. Okay?
Tell me you love me. I love you.
Now, you are in an abusive relationship, and many times that relationship can affect you. Your spouse is beating you, your wife is beating you. Yes, I'm talking to you, you're just watching me right now.
I can't do this anymore. Sorry. Now me the worst plate, now me the mob. The whole first one.
Your wife is beating you, your girlfriend is beating you, and then you don't know what to do. And you get to the office, you have panic attacks because you don't want to go home. By the time it's 3 or 4 p.m., you don't want to go home anymore, because why? You are scared of going home.
Useless man, there is nothing you can ever do in this life.
All right, it can be for the female, it can be for the male. Right now, one of the solutions for those things is seek help. Now, or you leave the relationship, or if it's a marriage already, you look for somebody who can talk to her to stop beating you. You are not a slave, young man. Okay. So emotional abuse can actually be a reason for panic attack. And also there is also a problem of trauma. People who have experienced traumatizing conditions. For example, you've been in a car accident before. So whenever you are about to travel to any places, you just have panic attacks. You may not be scared, but you just have panic attacks. It happens. When you talk yourself into it. Whatever faith you believe in, you can then address it so that you can be better. You can talk to somebody. Then you can maybe, if you have the alternative, you have the options, you can use another kind of of traveling, of transportation. If the accident was in a flight, you can use the road. If it was on the road, you can use flight. Depends. I don't know if the economy will allow you to do that, but it's fine. Those are the solutions that are there. All right. So the things that causes these palpitations are different for different persons. So whatever yours is, you address it individually. Now, please do not run to drugs. Now, the problem with using drugs to address anxiety and palpitation is because many times you are dealing with the issue physiologically, but there are emotional triggers. So if you keep on taking drugs and the emotional triggers are not addressed, you end up abusing those drugs and you end up depending on those drugs. And after a while, you have what they call tolerance, and those drugs will not work in their usual doses or will not even work at all. I've seen patients where medications failed for addressing their palpitations until when I was able to help them identify the stressor or the triggers, and they've got better. So that is the idea, or that is the way to address palpitation, and those are the reasons why palpitations occur. So if you have any more questions, you can drop them. I actually planned for this video to be 2 minutes now. Look at where I am. You can drop them in the comment section and I will address them individually, or maybe make a new video for whatever questions you have. Thank you very much, and bye.